I am Bryan Fletcher. I'm a psychiatrist here at Weed Army Community Hospital. I am Army Medicine. Our primary mission here is to maintain the readiness of our fighting force so that we can win our nation's wars. There are a lot of stressors that come with being in the military, whether it be a serious pathological condition that comes out due to the stress or simply the rigors of the day-to-day service members' role. We're here to help them. A lot of times there are things related to substance abuse that can occur, and we are here to help guide our young soldiers through that, or oftentimes relationship issues or adapting to new environments, or PTSD, which most have heard of. Whatever it is, we are here to help. Generally, as a psychiatrist, our work would be to help with mostly medications. We have a team of behavioral health providers who work with both therapy and the medication. We tend to do the medications and the medical side of behavioral health in conjunction with our other medical providers in the hospital. Currently, I am working a more administrative role, and it's kind of to meet the needs of the Army. And my role right now is an acting IDPH, and that's an acronym that means the Installation Director of Psychological Health. It's not a permanent position. I'm sitting in for a provider who is coming in to fill that role. I also work as the OIC, or Officer in Charge, of the Multi-D Clinic here at the hospital. And that means I am managing a team of social workers and psychologists and nurse case managers. In my training, the psychiatrists I worked with were primarily inpatient, which means they were working with serious pathology like schizophrenia or a psychotic disorder, mood disorder like bipolar disorder. Here I'm primarily outpatient, and the soldiers and dependents that I treat don't tend to have the same level of psychopathology, the serious mental conditions that a lot of civilian psychiatrists may be dealing with. Our soldiers tend to be a little bit younger in general, right? Younger, a little bit healthier, and when they're coming, it's more with difficulty adapting to some kind of a circumstance, whatever it might be, a typical life stressor. But they fall more on the normal spectrum of a behavioral health condition. So one of the most obvious, and it's the thing that I think attracts a lot of people, is the financial benefit of paying for the medical school. Right, so the scholarship, I did the HPSP scholarship, which means the military paid for all of my medical school, and they gave me a monthly stipend, and they paid for books and some other equipment. So financially, it was going through medical school. It was great. And I did my medical residency in Hawaii, which is obviously for most people would be awesome. And it was. I loved it. And that was 4 years. So 4 years of living in Hawaii. We don't worry about malpractice. Not to say there aren't repercussions for bad health care or mistakes you make. And there are also lots of opportunities for career growth that are not limited to medicine. Like my current position is mostly administrative. And there are opportunities I have right now in learning how to be an administrator and supervise other healthcare providers, and the complexity of this system, which a lot of providers may not get. You certainly don't get that in medical school, and very limited in a residency program. So that is, there are a lot of benefits there, especially when you're thinking about what do you want to do in the future. And if it has something to do with that administrative role, then a lot of great experience. Well, and I mean, just to just for fun, just the other day I went out and I was required to go out and being paid, obviously, to go qualify on my weapon. So I spent the morning out on the range shooting targets. I have friends who are jumping out of helicopters right now. So as far as that goes, there are a lot of opportunities there that you're not going to find elsewhere. I mean, that's not as far as career progression, but it can be a lot of fun. As far as other things, it's an honor to serve and to be part of this great organization in this capacity. And the people that we are able to work with here, it's a shared understanding of what's going on and a common goal. And so that camaraderie is also, it's also a wonderful thing as well. If you are undecided about what you want to do and you have a sense of adventure or you want to serve your country in some way of a sense of nationalism, then it can certainly be something where you could thrive in, could have a good time doing. There are a lot of opportunities. If you get in, doesn't work for you, then after your it's typically for most programs about 4 years, and after your 4 years, you can move on with a lot of great experiences and a lot of training that is pretty unique. The other major population would be those of our veterans that have experienced trauma, those traumatic experiences, downrange, deployed settings, and they're coming back with trauma that is not exclusive to the military, but definitely, you find it in abundance in the military. There are a lot of veterans suffering from trauma-related things such as PTSD. And the military is on the cutting edge of research as far as how to deal with those traumatic injuries. And I know they have some TBI, or the traumatic brain injury research that's going on. Yeah, if that is something, if academia or research is your interest, then there are lots of opportunities to do that. And the military psychiatrists are often showcased at a lot of the academic poster or presentation, or with the American Psychiatric Association when they're doing their meetings. What often happens with psychiatrists or medical providers who go into the military is very, very keyed in on your progression as a professional, your career. What the military would like is for you to become a long-term part of the culture, and they have different programs that help in that career development, which is, if you opt for that, it's laid out for you. They have something called Captain's Career Course, which helps with the captains to progress to the higher ranks, and major and lieutenant colonel, and on. You have more established professional courses and opportunities to progress in that way. As you advance in the ranking system in the military, you will be assuming more and more administrative type roles, and you will have more opportunities to lead and structure kind of what Army medicine and military look like.